Welcome to the village. Welcome back to the Carla series.
Thanks for having me.
Carla's not sick of me yet.
No, not at all.
No, but I appreciate you being here again because it's been a few months and we're well back into the sports seasons in school, right?
Yep, we just finished our fall season. Actually, last Saturday. We get a little reprieve, and then we are back to our winter sports come Monday. Monday is first day of winter sport tryouts.
Okay, cool. And what are winter sports going to be entailing?
Most schools around here, particularly Amsterdam, we have indoor track. We have swimming for our middle schoolers.
Okay.
Wrestling, girls and boys basketball. We did merge with a couple other schools in the area, so we now offer ice hockey.
Wow.
Yeah,
that's kind of neat.
It's another opportunity to give our kids to be competitive. So by luxury of the draw, I get to cover those games, which is nice. It's a nice change of pace for me.
Yeah, how so with ice hockey?
Been used to with at least our league schedule is, it's basketball Monday, Tuesday, Thursday, Friday in some form, whether it's boys or girls, freshmen, JV, varsity. Wrestling is always on Wednesdays. And then we throw in hockey, and it's a nice change of pace. More of a contact sport, and you never know what's going to happen. You got guys on blades, so sharp objects.
More brutal, right?
It is.
Yeah.
And then, you're always hoping nobody gets hurt because then you have to walk across the ice.
Yeah.
It's a little bit different walking across the ice than it is walking across, say, the football field or the basketball court.
No, that is true. Oh, shout out to the Canadians there, huh?
Yeah.
Right?
Yeah.
Hopefully no missing teeth this season.
Let's hope not.
Yeah.
Let's hope not.
Let me ask you, too, because last time we spoke, we were talking about getting full-on back into sports, and not all the parents were comfortable sending their kids back. And how did you do with, getting the teams covered, having enough kids to play?
For a majority of our teams, we saw a spike in participation.
Okay.
Football in particular, which was a little surprising. Normally we have good numbers, but to see the numbers we had this year was unbelievable at all three levels. Last year, our JV team barely had enough kids to finish the season. Varsity team ended up with 39 guys. Our JV team had 40-something, and we had strong modified numbers where we actually ran out of equipment.
Wow.
We got a donation, and we're able to purchase more equipment so that all the kids could play. Our girls' soccer program was strong, all three levels. Boys struggled a little bit, but we've had that since the COVID season in which we played. But they had 20 some odd guys, not enough for two teams, but enough to be competitive.
Okay.
And a really strong showing on our cross country team where we could compete and score. Have enough runners to score, which is always important.
Good. So it was good for the morale. Good to get back to some.
It was, and watching the kids just all support one another.
Yeah.
And it's nice to see that again. And everybody's at each other's games, and they're cheering each other on, win or lose, and they're even traveling with each other.
Yeah.
So we're seeing the kids getting back to being kids.
Yeah, exactly, and learning their sportsmanship and having something to look forward to, because as we see, it carries through as adults, right?
Oh, absolutely.
Sportsmanship in the workplace, being a team.
Right.
Very important, things we don't want to forget.
No. I mean, that's what I say to everybody, and I had to fill out a questionnaire for this grant that we won, and why did you want to be involved in athletics?
Yeah.
What got you involved?
What a good question.
I always played sports as a kid growing up. So when I couldn't play anymore, I coached.
Yeah.
While I got my degree to be an athletic trainer, which, again, allowed me to be around athletics and be in medicine, but also take all those lessons I learned as an athlete and translate it from athlete, even the stuff I learned as coach, to these kids that I deal with on a daily basis. I mean, they all merge together, so it's not far off.
No, absolutely. I was not very good with the sports and stuff. I was on the math team. Does that count?
It counts.
Yeah,
it counts. Our football coach would approve of that one. He's our math teacher, so.
Oh, see, there you go. It's all connected. Our math teacher was the math team coach and the bowling coach, so I don't think he was much of a typical athlete, but hey, that's okay.
Yeah.
I wasn't good at bowling either, so I didn't go. But, it works. I do yoga now. It's all good.
Still athletic.
It's still, exactly. Like we always say, there's so many reasons to be in sports and involved. But we do have to keep our kids safe, not overdo it. And we definitely don't want them to overdo it to the point of injuries. And if we do have injuries, we need to address them appropriately, right? So now
That's what I tell my kids all the time.
Yeah.
Tell me now. Don't tell me 3 weeks ago. And,
yes.
And we actually did the Life of a College Athlete seminar for our senior and junior athletes last week, where it was a half day for the students, and then the staff had development day, in the afternoon. And we took the kids and we brought in 3 former local athletes who have all gone on to different things at various levels. One's coaching at the college level now, one is coaching at the high school level, and then we have one of them who just got drafted by the Marlins come speak to the kids. And
so cool.
I asked the question to them, tell them the difference between being injured in high school and being injured in college.
Oh, yeah.
And they all said, in college, they will tell you prehab is what's best.
Yep.
Go be in the athletic training room or go be in the weight room before you have a real reason to be in there.
That's such good advice. Prevention and conditioning, right?
Right.
So how would the kids do that? How much would they do that in a day? And what
So the lucky thing for us at Amsterdam and, a lot of the surrounding schools, Broad Albin, Gloversville, and those bigger schools down like the Albany way is we now have athletic trainers integrated into our school systems. So we're there during the day. So the kids during either a free period, a lunch, if they leave early or they come in late because they're a senior and they have a special schedule or they can't participate in PE, they can come work with us one-on-one and get that sort of prehab prevention or rehab when they're hurt.
When it happens, yep. No, so there's opportunities.
Yeah.
Just kind of pushing and reminding them. And probably one thing I think we had mentioned in another episode too is when you're not in your sport, make sure you're still active.
Right.
Don't start using those muscles and those ligaments that have not been used to anything for months.
Oh, absolutely. And that's what I like about a lot of our programs. So you take our football program, for example. We just finished our season last Thursday, so that's November 3rd or whatnot. And they give the kids a couple months off. Now, we do have a lot of kids doing some other sports, cross-training, which is fantastic. But then they won't ask them to be in the weight room again until after Christmas.
Yeah.
So it gives them a break if they need it. We get serious again, start lifting. We're very fortunate that one of our football coaches has his strength and conditioning certification. So he takes all our football players and any other athletes who really want to work on strength and conditioning and takes them in the weight room and puts them on a program.
That's great. Seems like you're very proactive.
We try to be.
Yeah.
It's that buy-in from the kids, sometimes from the parents of what lengths they're willing to go to. I say we're very fortunate to have the buy-in that we have.
Yeah, and it seems like everyone is involved and wants to make the best experience for these kids.
Absolutely. Again, just to see the showing of support we had this past fall season across all our sports. You look at, I don't want to say, you have your sports like football and soccer, which are always widely attended because they're, some of the most popular sports in the country. But then you have these less popular sports, but that doesn't make them any less better than football and soccer, like tennis and cross country. But to see the amount of kids participating and the amount of support that those guys have as well.
Yeah.
I ran cross country in high school, so I love our cross country team and our cross country coaches and just the support, especially for what we went through this year with one of our team members being involved in a very serious accident.
Oh, no.
And just the support that, as a community, that we gave to that runner was amazing.
Yeah, that's what team, it's like a family.
It is. And our football coach, before every game, he'll say 39 heartbeats beat as one. And he always says to the kids, he goes, a trip to the store takes a half hour because they'll be like, oh, how you doing? How are your kids? And he'll tell them about his daughter, tell them about his son, and then tell them about his 39 other sons.
Right, yeah.
And people just look at him like, what are you talking about?
Well, he's passionate, and it is.
We're a huge family.
And you need your coaches and your trainers and your teachers. You need everybody to be involved because after school hours and before school hours, you're seeing these kids. You could be the one that picks up on an issue they're having or be the one that talks to them about weird stuff that the parents don't want to talk about.
Right. That's the thing. Our school, our community sometimes gets a bad rap. Now that I'm kind of like fully embedded in there and seeing what happens in the day-to-day, tomorrow's the end of the marking period for our kids.
Yeah.
And today, I'm the athletic trainer. And we have our phys ed teachers, and we're not doing athletic training. We're not doing phys ed stuff. We are helping these kids with math homework, with English homework.
Because then they're nervous. They've got to make
like,
these
all right,
grades.
We got this.
Yeah, can you help me with this? Maybe they are nervous to talk to somebody, or they're comfortable with you, and which is good. We always encourage kids, talk to who you're comfortable with. I do so much kind of unofficial kind of therapy sessions and official therapy sessions, even though I'm not a social worker and I'm not a psychologist. But if that kid has seen me for years and they're comfortable, better to talk to them than send them to someone maybe they won't talk to. So whatever works, whichever adult, we're all adults are especially trained in a little bit of adulting, right?
So, absolutely.
With this, the pre-training is really important. So what kind of common injuries are we seeing, or that you're trying to avoid? How do we avoid? What are the injuries? How do you know? How do we treat? What should they do? I have so many questions for you. What do we do? Because I get involved with this. They come to me, and I mean, you as the trainer, you know what these injuries are. You know how they happen. You see them, and you know how to treat them.
Right.
They come to me, but really, I have so many times I have said, well, what did Carla say? Did you tell? Or I'll say, hold on, let me call Carla. And we've gotten on the phone.
Right.
And we've worked it out. So what do you think?
There's so many different, as we head into our winter sports from the fall sport. We do have quite a few kids who are played fall sport, now they're playing a winter sport. Yes, for cross training, but we still get those overuse injuries.
Right.
And then we have the acute injuries. So there's so many different things we go through on, especially with our modified kids. They're still growing. Every time they feel like a little pain, it's like, oh boy.
Yeah.
They get all panicky, and I'm just like, it's fine. Right. It's just a little tendinitis, and this is how we're going to treat it.
Yeah.
A lot of 7th and 8th graders, I'll look at them, I go, you just went through a growth spurt.
And your growth spurt is more pressure on your musculoskeletal system, so you're going to...
I go, your bones grew quicker than your muscles did.
Yeah, and so now we're more prone to injuries.
Right.
You said to treat it, I mean, there's the question of, say you have tendinitis, you've got this pain. Are you going to see a swelling, or do you see something? What do you see versus what do you feel?
Yeah, I mean, a lot of times it depends. Most tendinitises, there's no swelling. Mm-hmm. It's just that, the irritating pain that's right there, usually front of the knee, is a big one. The patellar tendinitis or the Osgood-Schlatter's, that bone where the patellar tendon attaches is a little bit bigger than some of your friends. So as you're jumping and running, it's stretching a little more than everybody else's. It just gets irritated. That's kind of how I explain it to the kids. Yeah. Then you got the growth plate issues with the severs. And, again, it's icing, stretching, heel cups. And a lot of, the kids go, all you ever do is say ice.
Yeah.
Ice, stretch. Yeah. And I'm like, well, that's
pretty much what you do for these things. And you work through it, right? Like with those two in particular, you've talked about very common with the front of the knee. Mm-hmm. And if I press on it, it is tender and sometimes bigger. Right. And the severs is like your heel, right? So there's a lot of heel pain. May hurt if I touch that too. Those things are pre-stretching. You need to do the pre-stretching, right, to help. Right. And then you need to do the icing after. Now, do you keep exercising through these things?
Usually I leave it up to pain tolerance and how they're actually performing. If I got a kid who's limping, I'm going to take them out. We're going to do some stuff. Yeah. Non-weight bearing in my office. Yeah. With the patellar tendinitis or Osgood-Schlatter's, I try to tell them to do the ice massage. So you fill the little Dixie cups, and I always have to, they always look at me like, what's a Dixie cup? Yeah. I go, those little cups you get when you go to the dentist?
Right, yeah.
They go, yeah.
Gargle, spit,
yeah, right.
Gargle,
I pull out the Gatorade cups that we use for water on the sidelines, and I say, just fill them with water, put them in your freezer, then you take them out. And I said, just as it sounds, you take the cup that's full of ice, tear off the top, and then you just kind of massage over that area in like a little circular motion for the knee and the elbow and shin splints. With the severs, I try and have them roll a frozen water bottle underneath, lacrosse ball, baseball, something hard to like really get into those kind of muscles. Massage, like a deep tissue massage. And then the stretching.
Stretching your calf muscles. Key. Yeah. I've seen a lot of pictures that kind of explain stretches, like putting your hands up against the wall and just kind of stretching your leg back. That's good. Keep the muscle looser, right?
Right. I mean, stretching is important regardless.
Yeah, yeah.
I don't think our kids do enough of it.
Right. You want to get right into the game or right into the practice. You don't want to take that time.
Yeah. Like we had to have this conversation with our majorette team. So, you know, now we've just gone outside of sports. We're working with the band now.
Yeah. Oh, yeah. But yeah,
with the marching and everything, and you know, our majorette advisor, you know, she'll come see me and say, hey, you know, this is what's wrong with this one. What can we do for it? I mean, we work really well together. You know, we got a lot of kids. I'm like, you didn't stretch. So I went and talked to their captains, and I said, you know, a couple of your majorette are actually athletes, so they go through this. They know what to do. I said, use them.
Yeah.
They'll teach you the exercises.
Exactly. That's true. We've got to work together.
Yeah.
Use people's strengths and knowledge. So actually, this is one of the reasons that I was never a big athlete to begin with, and then they started us on lacrosse in high school, so we didn't have lacrosse in the younger years, but that was an option. So my sister was a lacrosse player, so I always wanted to try whatever she tried. So the only thing I did on my own that she hadn't done was math team. Of course, she wasn't a mathlete like me. And Girl Scouts when I was younger. So those were the things that I thought of on my own. So I tried lacrosse, and I got that knee pain. And when I think about it, it probably was Osgood-Schlatters. And our trainer, he told me I had high kneecaps, and he was like teaching me some things to do, but I think it wasn't really pushed a lot. There wasn't as much, I would say, like a support, like a push, like you got this, you can work through this. Like there wasn't a lot of that. It's very discouraging for me because I was like, well, I'm just not an athlete. This isn't my thing. So I'm having pain, and I gave it up. But to have like a Carla who, like, you were in high school then yourself, so you couldn't have helped me, and you were up here, I was down in Jersey. If only we knew each other, maybe I would have been a lacrosse player today.
Right.
But yeah, I think that's so important, because what I'm hearing from you consistently, all the years I've known you and on all these recordings, is that you got this attitude. We are going to do this. These are the things you need to do to succeed. I'm going to help you succeed. You'll do whatever you can to keep these kids feeling positive.
I try my best, and you know, a lot of them have those tough conversations.
Yeah.
You know, I got kids, I go, I haven't seen you in a week. Where have you been?
Yeah.
I go, if you're not going to put in the work, this isn't going to work.
Right.
I have the tools. I can give you the tools, but you have to put in the effort.
Yeah.
I mean, I've also had some of those frank conversations, especially with some of our football players, by going, this is football.
Right.
You will get hit. It might hurt.
Yes.
But you have to determine whether or not it's sore and we can push through this, or you're really hurt.
Right.
And that's the advantage of actually getting to know the kids.
Yeah.
And not just, I remember in college, one of my preceptors be like, oh yeah, the kid with the knee pain, the kid with the hamstring.
Right.
You know, and I get to know my kids because it's the same ones over and over. So when something does go wrong, it's like, okay, I know. And we had a football game, I call it the massacre, because I felt like I was at a mass casualty event.
Oh, God.
I had 4 kids go down within a half hour, and we had to call in 2 ambulances within 15 minutes.
Oh, no.
And so I'm dealing with the one kid whose, you know, concussion symptoms are pretty severe, and I'm trying to do the evaluation.
Right.
But then we have another kid go down, and I'm like, is he? I mean, he could be a little dramatic sometimes, but you know, I'm like, all right, I'll be right back. I go out there and, you know, start doing the evaluation. Now he's got C-spine pain, and I'm like, it's right here.
God.
And he goes, yeah. And I'm like, he goes,
yikes.
yeah, it's in my back. I was like, all right. So I have that look, apparently.
Yeah.
I just look at my head coach, and he knows what to do.
Yeah.
And he's like, all right. He calls the ambulance, and, you know, thankfully the fire department was actually on scene already at that point in time, so that helped. And the athletic trainer from the team we were playing is somebody who worked for me like 9 years ago. Yeah. So we were familiar with one another,
so that's
which helped. And I finished with him, and I go back to the kid with the severe symptoms and the concussion. We start doing the evaluation, and then another kid goes down, and I looked at who it was, and it's not a kid who's dramatic or complains. Mm-hmm. He's just, the best way to describe it is, you know, he's a hard worker. He doesn't complain, and he just puts his nose down, and he doesn't say, you know, this is hard, or never complains. So to see him down, I knew something was wrong. Sure enough, I go out there, and he ended up with a broken tib fib.
Oh, no. It is a massacre. Oh, my God.
Yeah.
Crazy
and so
night.
we called the ambulance back. I just looked at my coach, and he knew, again, so he calls the ambulance.
And this was a football game?
This was a football game, yeah. I went back, finished with the other kid, and then we got another concussion, so that was...
Back to back.
Yeah, but again, knowing your kids is huge.
Yeah, exactly. You know what to expect personality-wise is important.
Are you hurt? Are you not hurt?
Right.
So.
And you can tell. We had our whole concussion conversation, so anybody that's listening, please listen, because we had a lot to say. Carla really had a lot to educate us on that day. So yeah, I've seen some of these injuries that you talked about. Now, what about, you said, like, we're talking about how ankle sprains and other kind of sprains, and people do get confused, sprain, strain.
Right.
Yeah, so what's going on there?
Especially with the sprains and the strains. You know, again, they do get confused, but, you know, the way I always describe to kids, I go, sprains are for ligaments, strains are for muscles.
Okay.
They're like, are you sure? I'm like, yeah.
Are you sure?
Yeah, yeah.
I love that, right?
Yeah, are you sure?
I've had kids ask me if I'm sure about things, too.
Like, no, I'm not sure about this. I
just
don't
kind
know
of made
anything.
that up on the spot. Never saw it before.
So with sprains, most common are ankles, knees, some shoulders. Ankles are the big ones. And that, again, goes back to the kind of shoes,
Okay.
the footwear that we're wearing. You know, we got all these cool footwear now. You got the Crocs, the Vans, the Converse, the Yeezys, the Cloud. I mean, I see these kids walk in with, I'm like, what are you wearing on your feet? Or slippers, Uggs.
Yeah,
There's
Uggs. Oh my
no-
God. Uggs are comfortable, but
There's no
they're
support.
not for sports. No.
There's no support to any of them, and that's what these kids live in.
Yeah.
And I was describing this to our majorette advisor the other day, because we were talking, and she said, well, why is this the case? I said, if you think about it, back when we were kids, because her and I graduated together, I said, we didn't have these things. We didn't have, Crocs or slides
these
or
cool shoes.
the Yeezys or the Uggs or anything like that. We wore
Reeboks.
sneakers. We wore Nike and Reeboks.
Right.
Maybe some New Balance, maybe some Asics, you know, that stuff.
Even me, a non-athlete, I didn't have, like, those other cool options. We wore Reeboks and Nikes.
Right. Like, our stuff had support, and these kids don't. Now you see a lot. It starts, like, when they're younger, when they're born, and they make all these cute shoes for these babies, but as we know, that really is stunting the growth of their feet and how they're walking, because we know young kids grow so quickly. So you buy these, they're not cheap.
They're not.
You're buying $200 Uggs.
You're not going to be in them very long.
No, and so they're trying to grow and their foot's stuck in there, and then when they do learn to walk, they're walking all funny.
Yeah.
You know, when we were kids, we didn't have footwear. You know, our parents just said, here you go. So we had that involvement with the bare feet, or even with socks, just trying to, grip whatever surface we were walking on. So those little muscles in our feet got to work.
Yeah.
These kids don't have that. And then when they're walking around all day long in unsupported footwear, it's really taking a toll, which is then causing their arches to fall. And then that changes the way that the ligaments are positioned in the ankle, and it's changing the way that the muscles are pulling. So then we're more prone to whatever foot injury, whether it be midfoot sprain, ankle sprain, or a pull of whether it be the calf muscles, the anterior muscles, or even shin splints. And then we go up the kinetic chain. So now it affects the knee.
Yeah.
And then we're going up, and now it affects your hips.
Yeah,
And
so
then
all
it
the
affects your
joints.
back.
Yeah.
Yeah. So
These are things to think about. We're kind of training these kids from the time they're little.
right. Then we get into our sports where we have cleats.
Yeah.
We have to have the coolest, freshest, most obnoxious looking pair of cleats.
Yeah.
And while they might look good, or as kids like to say, drip.
Right. We talked about drip.
Yep. If you don't have drip, you're not cool.
Yeah.
I come across these cleats that, they're high. They come up to your calf, but there's no support once you get past, the malleolus. And every time I take them and I just go like this, I go, and you think this support is where? As it's waving in the wind?
Yeah.
So, footwear is huge. Footwear is huge.
So from the time they're learning how to walk up until high school sports, we should be wearing supportive, like sneakers, and that can be for the little ones, so sneakers, but then can they wear things like the sandals and stuff when they're like little toddlers? Is that okay?
I think it's okay as long as we're not living in them.
Okay, that's interesting. I didn't know this.
Yeah.
This is important. This is like crucial if you're gonna have.
You need the ability for the whole proprioceptive piece of it. Your body needs to know where it is in space, and if you can't grip the ground the right way, it's going to throw everything off. Your balance is going to be off.
Back aches, things like
everything.
that too.
Yeah, you're going to be You'll be like me, 37 with a bulging disc.
Yeah. Well, you did everything you're supposed to, but did you lift something or?
No. I think it's just years of
Sports and
sports and wear and tear and
it's happening earlier. I don't have a full bulge. I think I have a bit of something because I do have, like I said, I have stiffness in my right lower extremity. It's much stiffer because I do have a little bit of a nerve issue, and I'm not 37 anymore. I'm 41, but it started in my 30s. So yeah, things are starting earlier now too.
Yeah. I mean, we're even seeing that with the kids. So
yeah, I've seen some kids, they have those typical sciatica symptoms. Okay, so you're saying this is preventative.
Right.
Like pediatrics for me, it's all about the prevention, so let's get better supportive shoes. Then if they do come in, I specifically remember calling you for shin splints before, and I remember the kid too. He's fine now, he's in college, he's doing okay. So how did those happen? What are they really, and what do we do about those?
That's more of an inflammation of those muscles on the anterior shin, specifically the tibialis right there on the front. A lot of times it's so many different things. Again, back to footwear, low arch, high arch is going to affect the way that muscle pulls. It's more of a stress to that muscle than a strain of anything else. If we let it go on too long, then we run the risk of that bone getting a stress fracture.
Okay.
And then we're having to stop.
One thing can lead to another.
So with my kids, we preach the whole prevention. So I have them come in. We do a lot of calf stretching, a lot of anterior muscle stretching, and then we work on what we call the intrinsic muscles of the foot. Plus, they do this ankle rehab program. It's quick, it's easy. They can do it on their own. They don't need me for it. But if we're strengthening the ankle, then in turn we're strengthening those anterior muscles. So I have a blue board that's uneven that I have them do counterclockwise motion and then a clockwise motion. They do that 25 times each way. Then we do balance on an uneven surface, 15 seconds, 5 times. And then we do simple calf raises. I've taught them towel curls. You ever just take a towel and use your toes to curl it? Okay. So that works on those tiny muscles in the foot. Yeah. Marble pickups. So you take marbles, put them on the ground, pick them up with your toes, put them in a bucket or a cup. And then we do all the motions of the ankle with a resistive band. So just working on. And with the shin splints, I give them the ice massage. You can do this at home. We're fortunate enough to have the tools at our disposal at the high school level where we have an ice machine that does cold and compression and circulates in a figure 8 pattern to help decrease the amount of inflammation. Then we have, the kids call them the space boots, the sequential compression that kind of like acts as massaging, but also we're pumping the lactic acid out of whether it be the lower extremity, the upper extremity, the hip region, and it just kind of like milks it through these attachments. Everybody loves them.
No, it sounds like nice, like healing.
Yeah.
How do we avoid shin splints though?
Again, goes back to prevention and footwear.
Okay, so footwear is a lot.
It's huge.
So stretching and footwear are big things for anybody, but particularly for an athlete. Yeah,
especially our runners.
Yeah.
And changing up the terrain you're running on too.
Okay.
If you think about, your average person, they usually run the same route every day.
Yeah.
And so if you think about the way that the road's made, it kind of peaks.
Yeah.
And then one side's higher than the other.
Yeah.
So if you're running constantly in the same direction, you're constantly putting the same stress and angle on your body. So if you flip it to the other side, it changes. You're running the same direction, but you're just switching what side of the road you're on.
Yeah.
And you're kind of balancing it out.
Oh, that makes so much sense.
Yeah, or if you're, you run the same thing, run the same way on the track, you run the same, switch it up a little bit.
Yeah.
Or if you're running on grass or gravel, same thing. It's this uneven terrain. That always adds risk to it when you're on the uneven terrain.
Right, that's true.
But
that's more pressure.
Again, goes back to that good footwear and strengthening, stretching, all that good stuff.
So I was thinking, I had this little girl who is still having pain, and I started to wonder if she got a strain, because she remembers she was in gym class doing some sort of game. They're all running around, these kids. She's maybe 7 or 8, gym class too. And she suddenly felt like a pop, and that got me starting to think about strains. And that's the difference. You said strains are muscular.
Right.
So then you're kind of like ripping a muscle, in essence?
Yeah, you're kind of like pulling it apart.
Okay.
which goes back to that whole, I pulled a muscle.
Yeah.
So the
yeah.
muscle fibers are just stretching beyond normal.
Okay.
If you tear it, then we have a whole different issue. When you tear it, a couple different things happen. Depending on what muscle you tear, a lot of times, knock on wood, I have not had this happen yet. When it tears, it sounds like a t-shirt ripping. And then
that sounds awful.
And then it balls up. So you get
Yeah.
this big bulge, whether it's your
Yeah.
bicep or your hamstring, and it's ugly black and blues. The other thing you can have is what we call an avulsion fracture, where the tendon attaches, it actually pulls a piece of the muscle off. And that's more common in the hip area or at the base of the fifth metatarsal, right there on the outside of your foot, where you get that little bone that juts out.
Oh, that's horrible.
It is horrible.
Yeah.
I've had those happen.
Now, would you send them to a specialist for those type of things?
Yep.
I mean, if they came to my office and I saw any of those things, they're going right to
Right.
Mohawk Valley Orthopedics next door. I mean, that is where they're going. They get in pretty quick, too, especially if the kid's got something urgent going on.
Oh, absolutely. And they're phenomenal with our local athletes.
Yeah, they're really good. They're very helpful, and they understand injuries, and they take care of them quickly.
Yes.
That's a lot of stuff that could still happen. And are some of these things not preventable, though? Like if you just have the bad luck of getting someone jams into you or something.
Yeah. Yeah, or you step on something wrong.
Yeah.
I mean, that happens a lot with our cross-country runners or even some of our basketball players. They'll step on somebody's foot and come down on the side of their foot. Next thing you know, they have that avulsion fracture of the base of the fifth. We'd like to think we could prevent everything from happening, but
we want to protect our kids. It's natural.
It doesn't always happen that way.
Yeah.
And you go back to try and do a lot of the ankle prevention.
Yeah.
I'll tell my kids I won't tape them if they're not going to put in the effort and do the ankle rehab.
Yeah.
Because at that point, the tape is just a crutch.
Okay.
It's going to actually make you weaker if we just continue to tape. It's like a Band-Aid. So I want you to strengthen. We'll continue to tape for your games and stuff. But if you're someone who's non-acute injury, we're going to strengthen. We're going to make it better.
Yeah.
You go back to ACL sprains or tears. The thing to know about sprains is there's 3 degrees. There's first degree, second degree, third degree, where first degree is you stretch that ligament just a little bit. Second degree is a partial tear, and third degree is a complete tear. So once you get into that territory, things get a little murky. And so ACL tears, again, while you'd like to think you can prevent them all, you just can't. We do a lot of strengthening, especially with our female athletes, because they're more prone to tear just because of the Q angle of the hips.
That's so interesting.
Because their hips are wider,
Yeah.
the angle at which their femurs come out are a little bit different than that of males. So when their knees go in or out, they're more at risk for tearing or pulling muscles, all that good stuff. So you'll see more non-contact ACL tears in females than you will males.
Okay.
Again, contact ACL tears, there's nothing you're going to do about those.
Some things just happen at play.
Yeah, I mean, we see them all the time, and common mechanism, usually in the back of my mind, I know as soon as somebody says, I went to stop, turn, and change direction, and my knee gave out, I know at that point that they probably tore the ACL.
And that's pretty severe.
It's pretty significant. It's a lengthy rehab. You're looking at anywhere from 6 to 12 months.
Wow.
Depending on the amount of damage you've done.
For an athlete, a teenage athlete, they can't play.
They can't. And so again, we go through this whole host of emotions. I go back to one of our female basketball players who did it in January last year. And having to tell her that happened, that broke my heart.
Yeah.
Because she's such a good kid. Not that they aren't. They're all good kids.
Yeah.
But she was one of those kids where we have a really good relationship. And having to tell her, like, this happened. And we've worked through the rehab process since she had her surgery. We worked through the summer. We've been working all fall. And she actually did cross country. But she didn't compete on the team. I talked to the coach and said, hey, she's been on your team for 6 years. Let's just let her practice with you guys. Let her strengthen, get her, because basketball's her main sport. Senior night, it was our only home meet, and she ran the race.
Oh.
And it was heartwarming to be like, all right, you worked this hard
Yeah.
And you were able to not only run, but you ran well.
I was going to say, I'm sure she was so
Yeah.
happy and just gave it her all.
Yep, and so we're kind of towards the tail end of her rehab now, since basketball does start on Monday.
Right, yeah.
But last week, she had me out there on the track because it was so nice last week. We took the rehab outside, and we were doing basketball drills and just agility work, because agility is important and changing direction, especially in this type of injury. And we're just going back and forth out there, and I got ropes, and she's dragging me across the track. I was like, man, am I out of shape, trying to compete with a 17-year-old.
I cannot 17 anymore.
But yeah, she got her brace last week, and, she was nervous at first to go in the gym and try it out, but she's been doing open gym a week now, and she's just, she is killing it.
And she's going to be ready for basketball.
She'll be ready to come Monday to go out there.
She's probably so excited.
Oh my gosh, she is so excited.
And hard work pays off.
And that's what we just kept telling her, your hard work, you did it.
Yeah.
We helped you, but you did it.
Yeah.
You put in the work. We told you what to do, and you did it, and then some.
Yeah.
So she was one of those athletes I just loved to work with because I didn't have to beg her to do it.
Yeah.
There are kids that I'm begging to do hey, can you do your exercises without your phone? Can we not compete?
The phone. Right, exactly. You need to focus on it. And this is where we're losing a lot of focus. And part of the reason for athletics is to have that focus. Yeah. So phone's got to be away.
Absolutely.
Yeah, you're not going to...
I can only do so much.
Yeah, right. It's you got to focus on whatever the task is at hand.
Yeah.
You got to focus. That's one of the things we're trying to teach these kids. So really, it's up to you as the athlete to try to make the best out of it. And even if you fall down, get yourself up again, right?
Yeah. I've worked with a lot of different kids over the years, and it's funny to me, even at this point, 14 years into this, where kids are just I didn't want to tell you because I didn't want you to take me out.
Yeah.
And I'm like, well, you've waited so long, now that's the only choice we have.
Right, now you don't have other choices, and you just made things worse.
My philosophy has always been, if you can play and you can play safely, I'm going to let you play.
Exactly. It's exactly that is the issue. It's about safety. You're not doing it to be mean, you're doing it to keep them safe. Because you always say, you need your body and your brain for the rest of your life. So you got to take care of it now. Yeah. Kids are short-sighted. It's hard. It's a challenge.
They are.
And you can't how do you explain to a kid how you got the rest of your life and it's coming fast and furious at you? We were 16 just the other day.
Right.
Literally, I just told you, I remember that story from high school it was yesterday. Yeah, it comes at you. But to really drum that in kids' head, they're not built that way. Their minds aren't built that way.
No, it's very short-sighted. And
yeah.
I always tell them, you're looking at what's in front of you.
Yeah.
We're looking at the mountaintop in the background.
Yeah, exactly. What else, coming into this winter season, do you want to make sure that we talk about? The kids know, the parents know that we're trying to educate about now and have a discussion now going forward.
We're getting into a lot of sports where there's a lot of contact going on here.
Yeah.
You look at a sport like wrestling. So if you're in a sport like wrestling, you're going to want to watch out for all those skin rashes that can come.
As soon as you say wrestling, that pops into my mind.
Our coaches are really good about making sure and hammering it home that first thing you do when you get home is you shower. Doing some construction at the middle school, so we don't have the showers like we've had in the past.
Yeah.
But first thing you do when you get home is you shower, you use soap, and you make sure you're clean before you do anything. Wash your clothes.
Yeah.
But I think that goes for any of our sports because,
right.
How many of our kids, they finish practice and the practice jersey comes off, and it goes right in our bag.
Right.
And we take it out for the next
day.
It's no, we need to do a little laundry, and
right.
Now you want to go 1 or 2 days, but some of these kids go week, 2 weeks.
Yeah.
And it's just lingering there at the bottom of their dark
bag.
Right.
The dark, moist.
Yeah, as they take it off and it's all full of sweat.
Right.
Not only their sweat, everybody else's sweat.
Yeah, everybody's sweat.
So we really encourage making sure things are sprayed down with some sort of disinfectant, make sure things are clean.
Yeah. Like you said, skin rashes, you can get fungal rashes, you can get bacterial infections like skin infections, acne, back knee, you know? Like kids come in and wonder about their acne. Like, you got to wash your face, you have to wash your back, you have to have a loofah or something to get to your back, and you need to do it quickly. That sweat stays on there. It's going to create bacteria.
Yep.
Because you got all the oils attracting the bacteria. And like you said, with the wrestling, I mean, how much of the athlete's foot do you see in the other fungi, right?
Yeah. Wrestling, it's more apparent because the referees do skin checks before every meet because they're wearing the siglants, so most of their body's exposed. So the referees will do skin checks, but you're not getting skin checks in basketball and hockey, cross country, indoor track, any of that stuff. Football, we're not doing skin checks. Wrestling, because it is such a close contact sport, they're making sure, they don't want that liability
spreading it
going out there. I mean, wrestling is such a huge sport still to this day out there. It's not as glamorous as basketball, but it does a lot for you about determination and sticking with it and sportsmanship in general.
And you're seeing co-ed wrestling?
We do have a couple girls on our team, and New York State actually just this summer created girls wrestling as an official sport for the state. Cool. So now you can go to sectionals and compete against girls. Because before, our girls were competing against boys. And do we have girls that are good enough to beat our guys? Oh, yeah.
Yeah, I have a patient I'm thinking about. She's like 13, and she's a tough little cookie. She's in with the boys. I don't think she's Amsterdam. Actually, I'm not sure now. Yeah, she's in junior high, and she's killing it.
Yeah.
It's good to let everyone participate in what they enjoy. Actually, getting back to the skin quick, I wanted to ask you, because there's a lot of these topical antifungals. I love tea tree oil for any of these skin issues. It's a natural anti-inflammatory and antimicrobial, so any microbe. You got your bacteria, you got your fungi, all these skin things that can happen. It's strong, potent, so you do a few drops, but you gotta dilute it into some vitamin E or something. I always say that to the athletes or anybody with these skin things. We got kids with their underarms, we got a lot of, those dark hidden places. And I say diaper rashes for babies too. Is there any magical something that you like to tell these athletes?
We just use generic.
Yeah, the antifungal creams and
Usually just send them to one of the local stores. I say just get the generic one.
But then you have the prevention too, as you're treating the prevention.
Yep.
I like the Gold Bond powder for the feet.
Oh, yeah.
You know what else we got to do? We got to tell these athletes. When you come to the doctor's office after practice, some kind of foot deodorant, something's got to happen there. It's so funny. You walk in and I wear an N95 in every room now. So you walk in, you just never know. And I can still smell some of these feet through this N95.
Their equipment, ooh. I mean, I had a kid sitting on a treatment table the other day, and somebody warned me. They're like, his feet smell. And I had to walk to the other end of the room to take the stim pads off somebody else, and whew. That's potent. We got our football players with some of their stuff. One of our football players came up to me during the game, and he was telling me and the principal, like, oh yeah, my gloves really smell. And he put them in our face, and I was like, oh, dear Lord. I was like, that is terrible.
Yeah.
I'm like, I feel terrible for your parents.
Yeah.
Because you're bringing this into their houses, and your houses smell like this.
Yeah.
I go, and I know you're,
It's puberty, and there's a lot going on.
And I'm like, I know your parents are cleanly.
Yeah.
So you're not doing them a favor by bringing in your towels and your gloves and stuff.
Teenagers are so funny. But just be mindful of where are the deodorants, where are the powders. Wash your equipment and your clothes and your socks. Change your socks every day. Every day you gotta change those things.
Yeah, and spray your helmets down with the Lysol or something.
Yeah.
We were fortunate enough to get this helmet sensor grant for the fall for our football helmets, so we could measure the G-forces that our kids were getting hit with and where they were getting hit.
Yeah,
and I would
have
to put the sensors in the helmets every day, and they'd bring them to me, and I'm like, wow. Wow, this is bad. And I'm like, give me the spray. This is bad.
Right. This is a helmet too.
Finally, I just put the spray out and said, "Have at it."
Right. You're like, this is.
Wow,
this
does
is
my
all
office
you.
smell?
Yeah, right. Yeah, like, do you have windows in your new office?
I do not.
Oh no.
It was I've come a long way, so it's like
Right.
I started off in the locker room.
Yeah.
One door into each side of the locker room, but it was like a closet, and then
Yeah.
I moved up across from the gym to what was an office for our coaches, then became my office, and then this new office I have was started off when we built it as a storage closet, and then we got this grant for our phys ed department, so then it became a cardio room. And then when COVID hit, it went back to being like storage again.
Yeah.
Until I got on full time, and then it became my office, which is it's awesome. It's huge.
Yeah.
You know, I'm able to have 5 treatment tables. I have equipment in there. We can do rehab in there.
Yeah,
It's
which is great.
set up awesome, but there are no windows.
Yeah. They all can take into consideration the need for windows at an athletic trainer's office.
Yeah. Maybe in the next capital project, 20
Yeah.
years down the road.
Yeah. Yeah, exactly. That's a lot of little things to be mindful of for our kids. Anything else that you felt was important today coming up? We'll just trying to keep our kids safe, healthy, and enjoyable experiences, life lessons.
We teach them all. We hit all the, the highs and lows. And
Yeah.
we encourage kids to play multiple sports. The cross-training, the specialization of sports is really what increases our kids' risk for injury.
Yeah.
Especially the overuse injuries, because we're using the same muscles over
Right.
and over and over
Yeah.
again. I encourage our kids, our coaches encourage our kids, play as many sports as you can. So if you're playing, football in the fall, we have wrestling and basketball and indoor track for you.
Yeah.
Even bowling. Take your pick.
Yeah, bowling. Even math.
We got everything for you.
It's good to keep, work on all your muscles, try different skills, different skill sets, meet different kids. Yeah.
Absolutely. And you will become friends with some of these people you probably never thought. I mean, we have this kid on our football team. He is fantastic. He doesn't care if he plays. He's just happy to be on the team.
Oh.
And they put him in our last football game, and they tried him so hard to get him to score. He didn't get to score, but he did last year. And I remember, because as the athletic trainer, I can travel the sidelines of the football game. The coaches can't. The coaches and players can't. They are stopped at the 25-yard line.
Oh, okay.
So I have all this room. And so I got
see?
to go down to the end zone. I pulled out my phone, and I knew it was coming, so I videotaped it for him.
That's so cool.
And I sent it to him, and he
Wow.
actually used it in his farewell to football TikTok.
Oh.
We had a student staff volleyball tournament last night.
Oh, really? That sounds like fun.
Oh, we had a blast.
Yeah.
Each team had 7 people on it. You could have up to 2 staff members. And so our team had two staff members, me and Coach Palzak. He's one of our social studies teachers. And then 5 student athletes of just play different sports. They start with football, but some of them, we got a bowler, we got a lacrosse player, a wrestler, in addition to football. And they just had fun, and I texted the kids the team picture we took, and the one kid texted me back and said, he goes, "Well, thank you for allowing me to be part of the team."
Oh, that's so sweet.
I was like, man, I gotta have you on my team.
Yeah.
I just love that you don't care what other
Yeah.
people think, and I love that you are so super supportive. Just a good kid.
Yeah, that is so great. That is so, heartwarming to see, especially in this day when we're just, so much, not the healthy feel good.
Yeah.
We want to bring that back or encourage it as much as possible.
Absolutely. I
Yeah.
encourage every kid to participate in something.
Yeah.
Try something new.
Yeah.
And that's what I love about our track team, our indoor track team, outdoor track team, is there's something for everybody. And our coaches do a phenomenal job of trying to get 100 kids involved in some way, shape, or form into this.
And this is the time, right, when you're young. This is when you try different things, try different activities, sports, other things too, like try the chorus or band, try to play in it, do something. This is your time where your mind is open.
Yeah.
And you can always do it when you're older, but it's just, time gets away from us, and our brains don't learn skills the same way as they do when we're moldable as children. So
Right. Get out there, do something.
yeah.
Being active is best.
Keeps you out of trouble.
It does keep you out of
Keeps you
trouble. Keeps you off
away.
of TikTok and
Social media and
video games
and getting into bad or dangerous habits.
Yeah.
Very concerned about these kids and the habits.
We try our best, and they always laugh at me because I have two posters in my office. One says the harmful effects of alcohol, the other one's the harmful effects of marijuana.
Mm-hmm.
And they think it's a big joke
Yeah.
that they're up there, and I'm like, guys, no.
Yeah.
Binge drinking should not be
Right.
happening when
No.
you're 14.
Exactly. You shouldn't have any need for any of those things. You should be high on the cool things that my dad used to always say, because we don't drink in our family, don't drink alcohol for religious reasons. So when he was at work parties and things, he would say, I don't need to drink. I'm high on life. Yeah, be high on your sport. Be high on your friends. Be, in what you're doing. It's life. I always tell kids, the world is your oyster. There's a big world out there. You're not in this one spot forever. Try different things and be happy.
I try and tell them I like country music. They all like rap and hip hop.
Yeah,
and pop.
that's like the thing
So
nowadays.
I'll play it in my office, and sometimes they'll like the song that I'm playing. And I had this one particular song, 7 and 70, it's called.
Mm-hmm.
But the point of the song was, there's only two people in your life you need to make proud, and that's who you are at 7 and who you are at 70.
Mm-hmm.
So, that's a message I keep reminding the kids.
Yeah.
And, when we had our senior night a couple weeks ago, and we're losing 22 seniors off our football team of 39 guys.
Yeah.
And these are kids that I've had for 6 years and have grown extremely close with, because these are the kids that fought for me, fought for this job.
Yeah.
And I reminded one of them, I said, play for the 8-year-old you.
Oh.
Be proud of that.
Yeah.
Make him proud.
Yeah.
Don't worry about anybody else. I said, because your family's already proud of you.
Right.
Your coach is already proud of you.
Yeah.
Play for the 8-year-old you. When you love the game, for the simple reason you love the game.
Yeah.
And there was nothing tied to it.
Yeah.
So that's a message I like to give to the kids.
So beautiful. Imagine your little self standing there and oh, wow, I'm going to be so good one day. So, be proud to be you.
Yeah, don't be anybody else, be you.
Yeah. Yeah, and 70-year-old you too, look back and say, I'm glad I did that. I'm glad I made those choices.
Right. And I relate a lot of stuff to music and...
Yeah, music is...
life's a dance.
Right, yeah.
And Garth Brooks, you could have missed the pain, but you would have missed the dance. So you could have thrown all that bad stuff away, but you would have missed this life that you've made and this journey that you've been on if you threw away all the bad,
So cool. I love it. Wow. I think it's a great place for food for thought for people. That's a great place to leave people with that thought, right?
Yeah.
Thanks so much again. And Carla series continues.
You're very welcome. Thank you for having me back.
No, thank you for coming over, and happy holidays. I'm sure we'll regroup, and at this point I think you're going to get pretty busy with sports, so 2023, you and me, same place.
Sounds good. Yeah, we're gonna start gearing up in December.
Okay.
Basketball, full on, wrestling,
Yeah.
hockey. We got a big basketball tournament after Christmas. Our girls basketball program does a phenomenal job. This year, I think we have 18 teams coming from all over the Northeast.
Wow. It's going to be a big
play
one.
here in Amsterdam for 2 days.
Back in. No joke.
No joke.
That'll be awesome. No, it's good for all the kids.
Yeah, no, I'm excited. I enjoy it. It's 2 very long days.
Yeah.
But what we get out of it, can't complain.
Right. Well, thanks, Carla.
Thank you.